Hi there. I know that getting a diagnosis like this can be, well, a really difficult and confusing time. My goal today is just to walk with you through some of the information you've been given and hopefully make it all a little easier to understand. Before we get started, I just want to share a quick but important reminder. I am here to help you learn, but please remember that I am an AI educator, not your doctor. It's always so important to check in with your real-life healthcare team before making any changes to your routine. You know, it is completely understandable to feel overwhelmed when you're hearing all this complicated language from doctors or in articles. It can honestly feel like you have to learn a whole new language overnight. So today, we're just going to break these terms down together, one simple step at a time. How does that sound? Okay, so where do we start? Well, to really understand what's happening, it helps to first get to know the part of the body we're talking about. So let's start with the absolute basics, your pancreas. As you can see here, the pancreas is an organ that sits pretty deep inside your belly, kind of tucked away right behind your stomach. It's a quiet organ, for sure, but it is very, very busy. So what does this little organ actually do? Well, it has two really important jobs. First, it makes special juices that help your body break down and digest the food you eat. And second, it makes hormones, like insulin, which are crucial for controlling the sugar levels in your blood. Pretty simple, but incredibly important. Does that part make sense? Okay, so now let's dive into some of the medical words you might be hearing. I promise, once we unpack them together, they won't seem nearly as intimidating as they might sound at first. So this is a big one you may have heard. Pancreatic adenocarcinoma. Woo, that's a mouthful, right? But it's really just the medical name for the most common type of pancreatic cancer. All it means is that the cancer started in the cells that line the tiny little tubes inside the pancreas. You can think of those tubes, they're called ducts, like little straws that carry the digestive juices. Does that picture help at all? So you might be wondering, what does this actually feel like? What kind of signs or symptoms can it cause in the body? Well, one of the first things people sometimes notice is something called jaundice. This is when your skin and the whites of your eyes start to look yellowish. It happens because if a tumor grows, it can press on and block a nearby tube called the bile duct. When that tube gets blocked, a yellow waste product from your liver can't get out, so it builds up in their body. This can also be the reason for darker urine or paler stools than what you're used to. Now, doctors also think about things that might make someone more likely to develop this condition. We call these risk factors. Some of them include long-term swelling of the pancreas, which is also known as chronic pancreatitis. Having a higher body weight can also be a factor, and sometimes certain health conditions that run in families can play a role too. So, when your doctors need to learn more about what's going on, they have some really amazing tools that help them create a clear picture inside your body. It's all about getting that clear picture so they can work with you to make the best possible plan. And this process usually follows a few straightforward steps. First, they'll take some pictures. Then, if they need to, they might get an even closer look. And finally, they'll do a test to be 100% sure about the diagnosis. Let's look at each of those. One of the first tools they often turn to is called a CT scan, and you can just think of it like a super smart camera. It takes a whole bunch of X-ray pictures from all different angles, and then a computer stitches them all together to create a really detailed 3D map of your organs. Okay, another test you might hear about is an EUS. For this, a doctor uses a very thin, flexible tube that has a tiny ultrasound on the very end. And because your stomach is literally right next door to your pancreas, this tool lets them get an incredibly clear, up-close picture from the inside. Does that make sense? All right, this next step is really the most important one. While pictures and scans can show a spot that might be cancer, the only way to know for sure is with something called a biopsy. This is when a doctor takes a very, very tiny piece of tissue from the area to look at under a microscope. This is the one test that can confirm if cancer cells are actually there. So once the diagnosis is confirmed with that biopsy, the very next step is for you and your team to make a plan. Let's talk a little bit about what might come next and what some of those words you'll hear really mean. This picture here kind of helps show what your doctors are trying to figure out next. They really want to understand two things: how big the cancer is and if it has moved from where it first started. This whole process is called staging. So you see, staging isn't just about giving something a label. It's a really, really helpful process. It helps your doctors understand the cancer's size and its location so they can work together to choose the absolute best treatment for you. It's all about creating the right plan. Generally, there are three main stages to know about. If a doctor says the cancer is localized, that just means it's only found inside the pancreas. Regional means it has grown a little bit into the areas right next to the pancreas. And metastatic means the cancer has traveled to other parts of the body, like the liver. Knowing this is what helps create the right treatment plan. Does that explanation help clear things up? Now, one of the most common treatments you'll probably hear about is chemotherapy. This is a term for powerful medicines that are really good at finding and killing cells that grow quickly, like cancer cells. And these medicines travel all through your body to do their job. Okay, I really want to pause on this next part because it is so important to remember. Your treatment isn't just about fighting the cancer itself. It's just as much about keeping you as comfortable and as strong as possible through this whole journey. And that's exactly where a special kind of support called palliative care comes in. This is specialized medical care that's completely focused on giving you relief from symptoms, from pain, and from the stress that comes with a serious illness. You can think of it as an extra layer of support, just for you. Now, a lot of people hear palliative care and they get it confused with hospice care, but it's really important to know they are very different things. The main thing to remember is that you can have palliative care at any stage of an illness, right alongside your cancer treatments. Hospice care is for providing comfort after treatments have stopped. Palliative care is there to help support your quality of life right from the very beginning of your journey. Wow, we've really covered a lot of ground today. As we finish up, I just want to leave you with this one thought. Out of all the questions we've talked about, the most important ones are the ones that are on your mind right now. Please write down your questions, ask your doctors, ask your nurses. Being an active part of your own care team is truly one of the most powerful things you can do. Just remember to take this all one step at a time.